Hello, I'm Dr. Ramsey, Amin, BurbankDentalImplants.com, and the topic today is something that is becoming more and more common. It's the patient that has a lot of implants already and may be losing additional teeth. So we see this a lot in maybe the baby boomer age. The topic is kind of converting implants, or when do we just stop adding implants and maybe make a whole bridge instead, using the existing implants that you have, maybe. So oftentimes, let's say over the years you've had, one, two, or three implants, or maybe you had one here and then one here and then one here. And, on top, you may have already 4 or 5 implants, but you're maybe losing a couple of more teeth. Oftentimes, as we age, we can get decay in the roots. We call root decay, which is quite common as our roots become exposed, and those areas that aren't protected by enamel are exposed, and we get cavities not on the biting surface, but the areas that we can't see them. So this is a common thing that I'm running into more and more nowadays, as my cases are very complex. Oftentimes I treat patients that nobody wants to treat or can treat because they're too complicated. When we have a lot of implants already, let's say if you have 4 or 5 or 6, remember 4 to 6 implants will support an entire bridge. More implants is not better. More bone is better, and more space between implants is better. So you never want to have crowded implants. Like you never would want to have one implant per tooth, especially in the front of the mouth where the bone does not have enough blood supply. Those typically lead to bone loss. So if you already have 4 or 5 or 6 implants and they're in the right distribution, that means one is here, one is here, one is here, one is here, like a pattern of 4 or more, then maybe think about converting those and using those, repurposing, right? Repurposing those implants for maybe a full arch restoration. It's more complicated than it seems. You can't just necessarily take off a crown and then put on a new bridge. But let's talk a little about what happens in converting. So again, we don't want to just keep adding implants. And these cases are complicated because there's oftentimes different manufacturers of implants in your mouth. You may not have, let's say I'm just using cars as an example, a Honda here, Toyota there, Mercedes there. And all of a sudden getting some uniform connection and finding laboratory and scanning parts that we can use to fabricate are often complicated. Sometimes contacting the previous dentist, they're not around or they've gone belly up, and we don't know what implant they are, and we have to just kind of find out. We don't want to take something apart without knowing what it is. So multiple different manufacturers become a problem as well. Implants being too close to each other, or sometimes the implants aren't deep enough to be used for full arch restoration. So the goal is to make a kind of a horseshoe, all on 4, all on 6 type of bridge. But if the implants aren't deep enough, then we lead to weaknesses in the bridge. I have a whole blog on pink versus no pink, FP1 versus FP3 are the technicalities of it. So there's a lot to know about this topic, and the implants have to be level with one another, all right? We can't have one over here, one up high, one down low, one up high, and then your smile's going to look kind of uneven. And then there's this other thing to factor in, is it called transition line? Like, how much of your gum shows when we take out the teeth and use the existing implant? If we add any pink, how much will show? So these are all a lot of factors that go into these decisions about whether you can convert to a full arch restoration. Oftentimes it's much more economical than adding yet another implant. You're putting out one fire here while the other fire occurs over here. But it's a little more complicated getting there. It can be very costly. Some people think it's less costly since you already have the implants. But oftentimes the money for these cases, the expense comes in the prosthetics, or making the teeth is actually more costly than the surgery. And it takes a high level of skill to pull off these cases and to make them strong enough where they're just not constantly breaking or they don't look right. So it becomes, some people have kind of a hodgepodge of different colors and different lengths and different materials to uniformly make everything look nice. Maybe we have to remove some of the implants that we can't use them. Maybe we have to start all over and take everything out because the bone isn't level or the implants aren't level with the other implants or your teeth or how your smile line is supposed to look. But these are complex decisions to make. And if the implant has bone loss already, well, certainly we don't want to keep an implant that's has lost, a third of its bone already or half of its bone already. So I know I may have provided maybe more questions than answers, but it's not as simple as it may seem. One way to make a set of different implants more universal is to connect what we call multi-unit abutments to them. Those are universal connections that allow us to do photogrammetry or specialty scanning to universalize everything. So if you end up somewhere else in a different office, you have a uniform platform, kind of like a Phillips head or a flat head. Like everybody kind of knows what it is, and it's more universal. But keep in mind, most of these implants have proprietary connections. One manufacturer's screw doesn't work with another screw, and you have to have a large inventory and a lot of experience to treat these cases that have multiple different implants. But again, the goal of this post is to help you understand that don't just keep adding implants, because then your whole upper or lower jaw is kind of just full of holes, not enough bone, all the bone is gone. I had a patient today that she has way too many implants top and bottom. By the time I take everything out, all the bone has been destroyed. So now I'm forced to do zygomatic implants into the cheekbone because all of the upper bone is completely gone. Having less implants, having them spaced out properly gives you cleansability, the ability to use a water pick, the ability to use little proxy brushes in between. It is all by design. Having an expert lab cannot be underestimated. I know there's a lot of dental offices that do this kind of in-house, and I respect the way that that's done, but there's nothing that beats a lab technician with years of experience that really understands a partnership of how we get our patients to health and long-lasting longevity. The last thing you want to do is spend a lot of money taking things apart only to have to redo it again, right? And I know if you're watching this blog, you've had a dental implant already, you've had the experience, you've lost some bone, you've replaced it, maybe you've lost faith in the process. I'll cut this short as I've been talking for 7 or 8 minutes now. I think I can talk forever. Anyways, Dr. Ramsey, Amin, BurbankDentalImplants.com. And please post on my blog. I don't often get to YouTube as often. I'm often seeing patients, of course, but on our blog, on the website, there are 13,000 questions that I have answered over the last, it's got to be 15 years or so. So thank you for your support, and see you soon. Bye.